So there's lots of different ways to treat scoliosis, and it really depends on two things. What's the size of your curve, and where are you with regards to growth? So if you have a small curve and you're still growing, and let's say it's under 20 degrees, we often will just watch that curve. As the curve meets sort of a criteria where we consider it to be a medium-sized curve, let's say 25 or 30 degrees, and you're still growing, we often will do something to try to keep that curve from getting worse. The only scientifically proven treatment to try to keep scoliosis from getting worse in a growing child is a brace. And that brace is something that's meant to keep the curve from getting bigger. It does not correct it. And it is worn a vast majority of the day, but they are still allowed to do all of their sports and activities that they want to do. As the curve gets bigger, if it gets near the 45 to 50 degree range, whether you're still growing or not, those curves are at risk for getting worse into adulthood, and sometimes those children will actually need surgery. So it really depends where you are with regards to both the size of the curve as far as growing. If you're younger and have a lot of growth left, we may want to be more aggressive. If you're closer to the end of growth, we may be able to be a bit more conservative. But understanding where the curve sits in that growth spectrum is really important as far as treating your children most effectively. So the most important thing about treating children with scoliosis is going somewhere where they understand not only the natural history of scoliosis, but also growth rates, where people are with regards to maturity in their growth rates, and experts that take care of this every day and see children like this every day. And because that's going to be the most effective way to understand what's most likely to happen to the condition over time.